about first the prevalence of this. So if you are doing a school health screening program, does it involve the public sector health schools or the government schools, the private schools and the informal school, or that will at least include the school going children?
There was one big study done after COVID, and some of the doctors from American and European nations came to India, specifically the capital Delhi, and they went to good public schools. And then they realized that for every one student that was wearing glasses, there was one student who did not even know that he had refractive error in his eyes. So probably I feel that the awareness is lacking. Just like to add one thing for compliance. So there was one study done, it was a very interesting study. They found that children were not compliant to glasses. So then they asked the parents to wear glasses, and their children tend to follow the parents. So that was one of the things how they had better compliance with kids.
The refractive error coverage in school-based program is around 25 to 30% in our country. Coverage. That means nearly 70% children, they actually need spectacles, but they do not have. There may be various reasons. Maybe screening has been done, but spectacle has not been provided. Maybe spectacle is provided, but it was provided 1 year ago, 2 years ago. Now the child do not have this thing. The compliance may not be there.
What is happening in countries like China, Singapore, Korea and Taiwan, their incidence of myopia is much higher than India. Almost 80 to 90% children have become myopic. So what they've understood is that why is the incidence of myopia increasing? It is increasing because of two reasons. Because of overwork on mobile phones and computers and lack of outdoor exposure in sun. So what they've done in Taiwan and Singapore is that they've made it mandatory for school going children to go outdoors for 2 to 3 hours to reduce this incidence. Probably this can be incorporated in our country as well.